I'm Terry Benelli. I am the Executive Director of LISC, which stands for Local Initiative Support Corporation. I want to give you just a 30-second spiel about LISC so that you know what we are, and that then you'll be one of the anomalies that understand who we are. Not many folks do. But LISC is a connection for communities to resources. The premise of our work is that we know that government, foundations, and for-profit companies have capital, and residents and local institutions understand the need for capital. And so LISC attempts to bridge the gap by offering really the relationships and the expertise to support community organizations to attract the kind of resources that allow the communities to do their best work. The resources could be in the form of loans, we're a financial institution, grants, or capacity building. And we make investments in housing, businesses, and really other areas around social determinants of health, with a spectrum that's centered specifically around racial equity and places that have been historically underserved. So like I said, today we have probably we'll have close to 100 attendees. And I first want to welcome everyone to the conversation. But we all know that as panelists, you need to know your audience. And so we thought we'd start with a poll today to let us know what sector you either represent or spend most of your time thinking about. So I think someone from Flynn will open up the poll, and if you guys could just pick the sector that closely represents what you do on a daily basis or why you're here. So a little housekeeping reminder also. As we go through the conversation with the panelists today, there is a function on Zoom with chat, and I'm sure you're all familiar with it, but today we're going to use that tool as a way for the attendees to kind of talk back and forth with each other and provide some commentary. But if you have questions, and we hope that you do, we want you to go to the Q&A function, which is on the bottom right of the menu at the bottom of the page. And you can enter your questions there. And I'm going to do my best to pay attention to the Q&A and ask the panelists those questions so that they can provide answers for you. So it looks like in the poll, we've got a lot of folks from government. That seems to be the #1 sector. And then let's see, of course, a lot of housing folks from the nonprofit sector, and then from private nonprofit and philanthropy, which is a good thing. So we'll keep that in mind as we're answering the questions today. So I want to welcome everyone to my bubble, my affordable housing bubble. And it's actually my friends and colleagues on this call today, their bubble also, and we're really anxious to share our thoughts about affordable housing. I wanted to do a tiny bit of level setting on what is considered affordable housing. So it really has to do with your income. If you're paying 30% or less of your income for monthly rent or mortgage payments and utilities, then you're living in an affordable housing unit. I'm going to go out on a little bit of a limb here, but I believe that this topic is something that most of the attendees have recently thought about, either due to the dramatic rent and home sale prices that have increased over the past year, or you've probably heard about the topic in the news. More folks are facing hurdles around our lack of housing inventory. And so it's the topic is more prominent, I think, in broadcast news and also print news, and probably on Twitter. You know, shelter is absolutely fundamental to everyone's health and well-being. And with 291 people a day becoming our neighbors in this beautiful state, the spectrum of our housing choices are really kind of lacking in the state. That spectrum, or the full continuum of housing opportunities, is a basic need for a thriving community, from market rate rental and ownership options to our discussion today, which centers around housing that is made affordable through assistance programs. Affordability is a complicated connection between prevailing housing costs and prevailing incomes. Our mission today is to provide context around this complicated connection and the unhoused. So we want to start the conversation with Director Tom Simplot, who is the state of Arizona's housing director. He's been involved in housing issues since his time on the Phoenix City Council. Tom, I thought I'd start with a little bit of a softball. What is affordable housing? And do we have an affordable housing crisis in Arizona? And then move on to something a little tougher, but probably not for you. At a high level, what do you have planned to address affordable housing on a statewide level?
Thanks, Terry. Thrilled to be here. Some of you may know this is a repeat performance by those of us you see on the screen, and it is fun to be back with this crowd and with our colleagues. So, Terry, I'm so glad you started off with the overall definition of affordable housing. If you're spending over 30% of your monthly income, then you have a housing issue. Number one, affordable housing. Number two, I just want to say real briefly what it is that the Department of Housing is and what it actually is doing in a nutshell. And I want to make clear that everybody who's on the Zoom call today knows that the Department of Housing historically has been the conduit of funding and financing mechanisms for for-profit and nonprofit developers in the affordable housing arena. And we have done that very well over the past 25 years. However, given our current state of housing crisis, and Terry, I promise this gets to your question, we also know that we have to play a much more expanded role, that the Department of Housing isn't and can't just simply be a conduit to financing and funding mechanisms, but it also needs to be a connector, and it needs to play the role in the space of the entire housing spectrum. From homeless to housing. So in that regard, for the first time ever, the Department of Housing and the state of Arizona are working on a comprehensive statewide strategic plan for homelessness to housing. We're doing that in conjunction and in partnership with stakeholders around the state who have also worked so diligently to prepare their local and regional strategic plans already. We want to capitalize on those plans that are in place and to weave them together so we can identify not only the financial gaps, but the geographic gaps that we have in that system. While we're doing that, we're also looking at subpopulations and devising strategic plans to address that as well. So, for example, we're also focusing and in the process of creating a strategic plan for youth homelessness. And we're doing that with our partners, Arizona State University and the University of Arizona. The youth population and conversely, the senior population are two growing populations of the homeless epidemic. And we need to be able to identify what we have so we know what we need to be able to do. So one last item in answer to your question, Terry, and that is, since I began 6 months ago, or actually now it's been 7 months, we've been meeting regularly, weekly and now bi-weekly, with homeless, housing, and healthcare experts, determining and soliciting input and fact gathering on what's going on a weekly basis in our communities as we sit here. We're doing this not only in the Phoenix metro area, but also with our partners, Liz Morales, down in Tucson. We need to know what's going on in our communities before we can address how to respond to that. So by working with our housing, homeless, and healthcare experts, we've been able to weave together, or in the process of weaving together, again, a strategic plan about how we can best leverage the resources, the financial resources that are now flowing into our state. I know that's a long answer, but Terry, you gave me an opportunity. I wanted to make sure we wove enough of that into there. So I hope that answered that.
It sure does, Tom. So I'm going to follow up. I didn't realize, I guess, that you were meeting with the homeless, housing, and the healthcare experts so frequently. But could you elaborate more on the healthcare piece? I think that that's probably not something that everybody easily equates to housing. But our little bubble knows how important it is. But how about let's share that with those folks that joined the bubble today?
Absolutely. So Terry, we all know that 10 years ago, the housing industry, the housing providers, the stakeholders didn't probably talk to our healthcare providers and vice versa. Our healthcare providers, and let me define that I'm referring to are our Medicaid providers via Access. So private Medicaid providers and Access they're meeting with us now regularly to talk about what the challenges are, and again, what are the strategies so that we can reduce those gaps in financing and wraparound services that are so desperately needed for permanent supportive housing, bridge housing, transition housing, and of course our traditional shelters, which of course we also need to talk about on how we're going to incorporate the prior model of homeless services and how that's going to morph as we move into the future. Now that we know what we know over the past several decades of homeless services. So yes, at the end of the day, Terry, ongoing communication, looking at issues like braided services, looking at issues like sustainable funding for the wraparound services for our extremely low income housing. Those are imperative, especially as we're looking at these temporary dollars that are currently flowing into the state.
All right, thank you. We're going to move a little bit south to Liz Morales, who's our Tucson Director of Housing and Community Development. Liz has spent close to 20 years developing her expertise to lead the City of Tucson department. Liz, who in your community is at risk of becoming unhoused? And do you see that risk escalating with the pandemic and eviction crisis? And then if you could, no, we'll leave it at that, and then I'll probably have a couple of follow-ups.
Sure. Hi, everyone. Great to be here as well. You know, what we're seeing and what I'm going to share may not be surprising. Some might be surprising. When we're looking at those who are currently unhoused, as we're interacting with them, we know it can be a health crisis, whether it's medical or mental, aging out of foster care. We're seeing large numbers of those that are on the streets or in shelters. Of course, most people think about substance abuse or alcohol abuse. Domestic violence, unfortunately, leads people into homelessness, release from prison without any other supports. And the reality today, it's really any catastrophic event, losing a job, a divorce, anything like that. And we know just in Southern Arizona, our rents have been increasing where we were a little bit behind the Phoenix metropolitan area, but we have been just as hit hard as the Phoenix area. So as an example, in 2017, our rents were averaging $860. In 2021, it's $1,208. That's a 40% increase. And our home values, of course, as you know, are even more staggering. But when we're thinking about those who are at risk, we think of those through the eviction. We, you know, good and bad. Good in the sense that evictions are finally becoming something that we're all aware of. It's been a crisis for many years. And Matthew Desmond has written a book about it. Highly recommend his book called Evicted, if you really want to understand the impacts of eviction. But we know that the pandemic has really put a spotlight on it. And we've seen people who are not typically at risk at homeless now at risk of homelessness because of a potential eviction or having been evicted. So the good thing, as I said, there's good in it, in that we have seen some incredible changes, both nationally and in Tucson. Pima County has instituted a specialty court around evictions, assigning free legal assistance and navigators to help persons through that process. We need more of those type of changes so that we can help stop evictions and really find better solutions. But it's still, we're not all the way there, but it's an important issue that I think is solvable.
So Liz, who steps in to help in the absence of state or federal programs? Well,
in reality, what we know is if you have friends and family, they become the safety net for many people. We see a lot of overcrowding in our households across the state. Unfortunately, sometimes those bridges and often are burned and they lose those safety nets. We also know with those who don't have those natural supports, many end up with our schools having to deal with homelessness, emergency rooms, and our public safety. So those are not the places that should be dealing with people who are unhoused. Our nonprofits and our faith communities have always been a great source of help, but they really lack the resources. Even in this past year and a half, we received CARES funds and now ARPA funding. The reality is, even when we have the resources, we don't have the units. We don't have landlords participating with our programs. Rents are outside of our program parameters. So even when we have the resources, we're still finding serious challenges to being able to provide housing for many that are coming across our programs.
So interesting that you mentioned landlords and their participation in programs. I guess what agencies refer people to housing developments or to these landlords, the few and far between that participate? And if you could make a comment about why we think landlords aren't participating?
First of all, it's the market demand. So landlords, having done Section 8 for many years, we were used to good times for landlords, which meant less landlords working with our program. And when the rental market wasn't great, landlords would come in droves. Unfortunately, we have seen a longer period of time where landlords are not needing to work with our programs. They have sufficient applicants willing to pay their rents, not having to do the paperwork and other things that are required with working with programs. The issue now too is that their rents are outside of our parameters. So HUD fair market rents have been lagging behind what the real rental market is. So it makes it difficult, even if a landlord wants to participate with us, they are like, but can you pay our rents? So unless we can do that, they're moving on. So we have been working with landlord incentive programs, putting out quite a bit of money to try to get landlords to work with us. It's still challenging.
Okay, thank you. Well, we're going to move on to Shana Ellis, who has been engaged in housing service delivery and effectiveness with special populations, and is now the director of Action Nexus, and it's part of ASU, where they develop collaborative solutions for systems alignment for our unhoused neighbors. Shana, what are the trends that you're seeing in affordable housing or homelessness that we should be paying attention to, other than the obvious ones?
Well, I think one of the big trends that we need to acknowledge, right off the bat, are the racial inequities that exist in the people seeking affordable housing and individuals that are unsheltered. So, I mean, nationwide, the number of African Americans, it's more than triple in the homeless population that is in the general population. Native Americans are disproportionately represented by a 2-to-1 margin in the general population. So that needs to be acknowledged right off the bat. And organizations have and need to continue to create programs to address these inequities. Some other items that have really affected affordable housing: the rise of short-term rentals, Airbnbs and VRBOs. The state law prohibits cities from restricting a lot of these uses. So it makes it really, really tough. Places like Sedona and Flagstaff are having a particularly hard time with it. Their short-term rental units went from 300 to 1,000 pretty much overnight. And some cities, it's up to 20% of their existing inventory. So it's having a huge, huge impact. Another item that I just wanted to touch on related to this is when we were talking about vouchers, a lot of people do think that is a great solution. And I know this summer, the Biden administration released over 70,000 vouchers across the United States. Arizona received over 1,200 of those. But we literally have people that are in homeless shelters that have housing vouchers. We have people living on the streets that have vouchers. So to get back to what Liz said, that is a real tragedy, because it used to be that it took cities a long time for people to get from the bottom of the list to the top of the list, sometimes up to 5 years, and cities would literally close their list because their inventory wasn't moving. But now they actually qualify for a voucher and there's nowhere for them to take it. So, that is not a good trend at all. And I think that, another thing, and there was a great article written by Catherine Rager in the Arizona Republic. And I know that there were statistics that were provided by Director Simplot's office, but to have over, a shortage of over 200,000 units in our state, it's astounding. And we need to come up with some really creative solutions.
Shana, can you just tell everybody what a voucher is?
Well, I think Liz is probably better at that than I am. I know there's a lot of different vouchers, but basically you have to, there's income guidelines, there's all sorts of guidelines that you have to meet in order to qualify to have your rent subsidized.
There you go.
But again, as Liz said, the landlords have to accept it. They have to accept that subsidy. And when it's lower than what the market represents and the landlord isn't getting 100% of the rent, and they could rent it to someone else and get the full market rent, it makes it really, really difficult. So you're asking a landlord to accept less than the market. So Liz, did I sum that up correctly in simplistic terms?
Beautifully.
All right, thanks. If I was an attendee and, just entering our bubble, I don't know that I would have known what that meant. So Shana, also, how do we reach unhoused individuals to provide them with the services that we've all kind of commented on?
Well, there's lots, and I'm sure that Dee Dee has some things to add to this too, since she is a service provider. But one of the main ways is through the service providers. They are all connected to a homeless management information system called HMIS. So when an individual comes in for any kind of service, they are input into the system. So if they need medical or counseling or housing, all of their data is there. So that is one way people are tracked. But there are, of course, a lot of little glitches with it. If people don't check in to an agency in a certain amount of time, then they are kind of taken out of the pool. And so that makes it difficult because, people are unsheltered and a lot of times they're unseen. And so they get in the system and then they don't have contact for a while. So there are a lot of creative solutions as to how to continue to find people. We also have excellent outreach workers in many of the agencies and cities, and they go out and they talk to people and they know where people are, they know their story, they build trust with individuals in order to help get them into services. So, the connection with nonprofits and the faith community is very, very important. But with the housing piece, it's just tragic that those connections are made and people are willing to be housed and to access services, and then we don't have anywhere for them to go. So that is the real sad part.
Liz, did you want to make a comment about that?
I think Shana said it perfectly. I think it's really important that we understand part of the problem, and the elephant in the room, most people, when they hear Section 8, it has a lot of negative stigma to it. So the hard part too is understanding that Section 8 is not the negative connotation that it brings to light. All I would add to that is that as we work with these type of programs, we just have to work also on education to help people understand that these are necessary programs that will actually end homelessness, because the answer to homelessness is housing. And so I truly believe that we have resources. We just need to find a way to get it to the people, and then also have quality units and places where people want to live. So I'm super passionate about that. How do we change the minds of not just landlords, but of the residents around them.
Thanks, Liz. So we've heard a little bit of the state perspective. We've heard a little local perspective from Liz and the academic perspective from Shana. And I want to move on to the provider perspective from Dee Yazzie Devine, who's the president and CEO of Native American Connections. And she brings the practitioner perspective to our discussion. As a developer, owner, and operator of a spectrum of affordable housing communities, Dee, your services expanded during the pandemic. And I'm hoping that with your comments, you can tell us a little bit more about what you accomplished during the pandemic. But what circumstances dictate the need for the spectrum of housing options that you provide? And can you provide a peek into the comprehensive kind of strategy that Native American Connections delivers?
Yeah, thank you, Terry. And thank you, everybody. I can't believe we went through 5 of you. I don't think anybody said NIMBY. Nobody brought up the NIMBY word yet. So
We're thinking it.
I can't believe we got through everybody. So I'm just going to start with Native American Connections has about 1,000 units of a variety of different types of housing, as Terry said, which houses about 3,500 people on any given day. So during the pandemic, Native American Connections stayed open every single day. We didn't close a day. We didn't have our admin stay home. We have about 200 employees, and asking them to go to work every day and serve our community, we felt like we should be in the office too, supporting those people that are direct service providers. As Terry said, we have a broad spectrum. There is, I believe that every housing option, whatever it is, and Liz, you didn't talk about alternative dwelling units, so I'm sure you will before the conversation's over. We need everything. We need for you to, build that unit in the back of your lot that you have more room. We need people to rent out if they can. We need to stop the short-term rentals. But what Native American Connections does is we start right from shelter. So we have homeless services, homeless shelter, what we call no barrier for youth. And if we house our homeless youth now with wraparound services, all the words that everybody used, and we can prevent them from needing housing further down the road. We prevent them from going in the criminal justice system, using the healthcare system, and then needing chronic homeless supportive housing. If we can intervene with youth that are LGBTQ, youth that are former foster care, youth that are just struggling during the pandemic. If we can really intervene with youth, we're going to prevent housing needs in the future. So we're very focused on youth, and with some of the current funding and some being designated from the Arizona Department of Housing, we're really looking forward to opening up a youth shelter on the west side of the valley, and very excited about that to add additional opportunities for youth. If you can intervene with the youth and get them their GED or get them back to high school, you greatly lessen the chance of them ever being homeless again, because there's always these intersections between housing and healthcare, housing and workforce, getting a job, having a higher income so that you can afford, a safe, affordable place. So we're really focused on youth. When Tom was talking about youth and seniors, everybody talked about youth and seniors. So when you're on a fixed income, and I'm going to say on a senior retirement income or SSDI, some of our community that have some physical limitations or are on SSDI, and let's say their SSDI income or a fixed retire income is $1,000 to $1,500 a month. You could find a decent, safe place to live. But when everybody's talking about this 30% of your income as being affordable, when you now look that they need an apartment that's $300-400, under $500 a month, where are you going to find that? Everybody, I'm sure on this call, knows you can't find a place for $500 a month. The rental assistance program, we've got to crack that nut, because it is the most dignified way to house people that are on a lower income. They pay their fair share. they're paying the $500 a month that they can afford. And the rental gap comes in and pays that gap. And the landlord then gets paid their fair share for their rental unit. That is the way to go. We just have to get more rental units or more single family homes to rent. And we have to get the landlords, like everybody said, to say, why would I not want to provide housing to a senior on a fixed income that can pay their fair share of the rent, or somebody that is going through a challenge right now. And so I'm a firm believer of rental assistance. We provide, we opened bridge housing. Some of the motels opened up and provided transitional bridge housing for people that were high risk for COVID. We opened up in July of 2020, right in the middle of the high numbers in Arizona, and giving low income or homeless seniors a place to be during COVID. That is really when we solidified. Providers have been talking about it for years, the intersection between housing and healthcare. And Tom talked about meeting with access and Medicaid providers. We've got to do away with those silos, because people don't come in with siloed problems. They come in with needs. I need to be housed. I want a good job. I want to increase my income so I can take care of myself. They need good health care so they can have a job, and for their kids, they need childcare. And so that cross sector is really important. But that healthcare aspect, COVID solidified that. We now know that people need a safe place to be during a health pandemic. If you can't quarantine or shelter in, isolate when you're you might have family members exposed, or you're in these overcrowded situations, or you're homeless on the street. We really solidified that link between housing and healthcare. So we've opened up some of that bridge transitional housing. A lot of people are working on that issue. A lot of people want to keep that alive so that we can continue to provide these bridge places, get people off the streets, both the sheltered and the unsheltered, and get them off the streets while we have time to work on, their documentation and the paperwork it takes for a voucher, or for the time to get a landlord to accept that voucher. So I think we're really working on that bridge housing. We have about 650 units of affordable housing, and that is, I'm going to say, rents that range in the low of $375 a month to probably at the high about $850 a month. And those are, working families that have children, or they're some of the seniors we're talking about. And so we have about 650 units of that affordable housing, and some is right in the heart of downtown Phoenix. I've been working with Director Simplot when he was a council member for the city of Phoenix, and we chose to make affordability on the central core of Phoenix. So people are close to transportation, the services they need, they can get jobs in the downtown area where we can, house our service industry where they don't have to drive an hour or ride the bus for an hour. And so we really focused on the central core of Phoenix. So we have some rents in the heart of downtown Phoenix where rents are over $2,000 a month that start, in the 500s. We have a few attainable, and we're looking to do a little bit more attainable, and that's people in the 80% area median income and above. We need that range of housing. We're really excited to be working with the city of Phoenix on the Moreland, which is bringing another 230 units of both affordable and attainable to 3rd Street and the I-10, right there across from the Phoenix Art Center. So bringing some more affordability. In the heart of downtown Phoenix, we have residential substance use and mental health programs. And why would I bring up mental health and healthcare? Because it's residential, because it's a place, again, as part of our housing spectrum. If you really look at the places where people can be housed, we have people coming out of the criminal justice system where they entered the system because of drug addiction. A health crisis got them imprisoned. And so, and I just want to say something, I'm probably taking way more than my time, but when an issue begins to impact the general population, everybody's talking about housing now because more and more people, higher income people, their kids are not housed. The same thing has happened with drug addiction. when it was in the Black and brown communities and it was methamphetamine, we criminalized a health problem of drug addiction. And then as the opioid crisis spread, and it spread to a much general and broader population of all incomes, we began to realize that connection between a healthcare issue, drug addiction, and housing and criminal justice system. So we're doing a lot of reentry into our residential drug programs. We have sober living homes. So I'm a firm believer that we need every type of housing, including more market rate housing, because what is it, 215 people are coming to Phoenix every day, and they need that whole spectrum of housing. So whatever unit we can get, if we can get some of the for-profit market rate developers to think about, and we help them solve how they could include voluntarily some affordable housing as the right thing to do. I know it's penciled, this is cost of land, cost of construction, cost, the rental income, my property taxes, I know. But if we can find a way to make those units work, within their performance, we can get maybe everyone in our community thinking about how can I be one of those conduits to solving this affordable housing crisis. Everybody can do something. I'll stop there.
All right, thanks, Dee Dee. So lots of burning questions from the attendees, and I'm just going to go in the order that they came in. Aurelis asked early on, actually, is there a plan to do more public housing to accept that type of assistance? I'm thinking that might be Director Simplot or Liz to talk about public housing.
I'm going to defer that to Liz because public housing is typically built by our local governments and jurisdictions.
Yes, so, when we talk about public housing, people often think of Section 8, but it also is assets that the cities own or local municipalities. So in general, public housing is not growing. Section 8 has had small incremental changes. For instance, we've received vouchers for veteran homelessness, families in the DCS system, and more recently, as Shana had referenced earlier, around homelessness and persons fleeing domestic violence. So we're seeing small increases. If the Build Back Better bill passes, we will see a lot of vouchers that's in the bill currently. Again, those vouchers are only as good as we can utilize them. So that's a little bit of the frustration around that. But HUD funding has been very pretty level funding related to these type of housing programs. The one thing that's important to say is where we have seen incredible increases in affordable units has been around the low-income housing tax credit program. So thank God for that program that Director Simplot oversees, because that's been the most impactful way for us to get more affordable units. Okay.
So Catherine asked, can the panelists talk about need and creative solutions for affordable housing in rural communities? Any appetite for adaptive reuse of vacant buildings? Some of those buildings are also historic. Does anybody think that they can weigh in on rural communities? All right. Goes
Sure.
to you, Director Simplot.
I'm happy to take that one. So the Department of Housing, our primary responsibility is called balance of state. So whereas Tucson, Phoenix, Maricopa County, Pima County, they are the conduit and the provider of many financing opportunities or financing methods for development of new housing in the metropolitan areas. The Department of Housing actually is tasked with the rural housing development. And so Liz had mentioned low-income housing tax credits. The federal low-income housing tax credits, as well as the new state credits, state housing tax credits, all flow through the Department of Housing. Something to note, Liz mentioned this, the low-income housing tax credits, or LIHTC, there are two different types. There's 9% and there's 4%. These tax credits at the federal level have been in place since 1986. And President Ronald Reagan was the one who originally signed the executive order, and they have been continued ever since then because they have demonstrated, it has been demonstrated that they are the most one single successful method of financing, especially workforce and housing for extremely low income individuals. Why? Because when you look at development, land costs don't change just because a development is workforce or supportive housing. Labor costs to build that new community aren't any less because it's workforce or affordable housing. So given that financing gap, the low-income housing tax credit program is essential in order to build new units and has built millions of units across the country and here in Arizona. So in the rural areas, getting back to the question at hand, so in the rural areas, we have, by law, every year we create something called the Qualified Allocation Plan. And what that does is that dictates for each state, they create their own, and that QAP dictates how our low-income housing tax credits will be distributed here in Arizona. Every state does this. We are in the final stages of completing our QAP for next year, and we have tried to be vigilant and listen to the development community, for-profit and not-for-profit, by listening to them to ascertain what needs to be in that QAP to foster more development in our rural areas. So, for example, one of the things that is in the QAP is to allow developers to actually secure 2 projects using the QAP. So, for example, if you have a very qualified applicant like Dee and Native American Connections, in previous QAPs, they were limited to building 1 project with low-income housing tax credits. What we have done is we've expanded that. 1 can be in the rural areas and 1 can be in the urban areas. It is by far easier to build in our urban areas. Why? Labor shortages and goods, the shortages of goods. You need to have the building materials and you need to have the people to actually build what's out there. It is an ongoing struggle. I'm so glad somebody is here from Sedona. We know there's a housing shortage in Sedona, but Sedona is not alone. We know there's a housing shortage in Flagstaff. Kingman, the mayor of Kingman, as recently as 2 weeks ago, told me that they have a developer ready to build 300 to 400 new units, but they don't have the people power there to actually build it. That's a problem. So it isn't just one issue alone that got us into this, although extreme growth has contributed tremendously, but there's not going to be one tool that's going to get us out of this. We have to be thinking holistically about not just the financing tools, but also about how our local jurisdictions approve zoning and building entitlements, and we need our local jurisdictions to actually ask the big question. When approving a new, say a new distribution center with 300 new jobs, the next question should be, and where will those people live? Those are the questions that need to be embedded in our consciousness as we tackle this issue statewide. Sorry, Terry, I went a little long.
It's okay. So Dee, I think this next question is probably up your alley. Kim says co-occurring disorders and substance abuse can be precursors to homeless instability, which I think you actually alluded to. What's being done to address these issues so that they can stabilize the housing situation?
Yeah, so there's I can't believe that I left out our PSH units, which are permanent supportive housing for chronic homeless, in my description. There's a very large homeless housing community, provider community, as well as people that are working on homeless housing and are keenly aware that mental health issues, the domestic violence issues, the chronic medical conditions that have come to light, particularly during COVID, are part of the homeless housing issue. And so we have a whole coordinated entry system. We have our human service campus down at the large shelter in downtown Phoenix. The UMOM is the coordinated entry for families, and they work with the homeless providers across the county. And there's county efforts, there's, as Tom said, there's statewide efforts, there's provider efforts. There's quite a lot of efforts going on in really trying to end homelessness. Nobody brought up the VASH vouchers yet, but the vouchers for veterans, and there's working with the VA on trying to end veterans homelessness. And they have the same issues trying to place their VASH vouchers as well in terms of ending homelessness. But we do have a focus in the QIP that Tom was talking about for the low-income housing tax credit program, has had set-asides for permanent supportive housing for chronic homeless that encourages developers like us to go ahead and build new units for housing people that have experienced chronic homelessness. And then that intersection between mental health and homelessness, and working with the health plans, the mental health, behavioral health plans as integrated providers. We're both a healthcare provider providing those mental health services as well as a housing provider. There's other organizations like ours, and we're beginning to partner across the board. But it's a challenging issue. I think historically our federal government, and passed on to the cities, passed on to the counties, has funded in silos. We have these state departments at the federal level. Their compliance comes in silos. So you get your money from HUD for housing, you get your money from Department of Health and Human Services for Medicaid and healthcare services, and they come down to us in those silos. And I was mentioning that before, we've got to learn to break those down. And I think Tom gave a perfect example of how those state departments are, and now at the cities, they're beginning to just fund the needs of people across the board, and not in those siloed systems of the way we get our money and the way we have to comply and do all the due diligence for it. We're really trying to. Some of that flexibility has come, with COVID and with the CARES Act funds and now the ARP funds. For example, telehealth. Hopefully telehealth stays. That's been a revelation of particularly in rural areas where you might not have Medicaid, and healthcare providers. I think telehealth is around to stay. So.
Okay. So a couple of questions. One, I think I'm going to combine, but Darlene asked a question about what plans are there at the policy level to make changes such as inclusionary zoning. And I'm wondering if, Shana, that's something she was thinking about?
Well, inclusionary zoning, it's a little difficult in Arizona. I'll get into that. So what inclusionary zoning is requiring, when a developer builds new units, to include, that's where inclusionary comes from, some units that are affordable. So that's just the general definition. So I think it was mentioned earlier that it was hoped that some developers would voluntarily do this, and that's the only way that they can in Arizona right now. So our state legislature many years ago passed a rule that states that municipalities are not allowed to mandate inclusionary zoning. And believe me, cities have tried, and it does not work out. So it has to be voluntary. There are some creative things that can be done when developers come. They can offer to do this in exchange for something else. That's generally what happens. But I think I'll get into this just a little bit because it addresses some of the other questions that I've seen popping up. So parcels they have an underlying zoning. So it's like the land, and the paperwork that's filed with the city or the state says, if it's commercial, if it's agricultural, if it's single family, multifamily, there's all sorts of different zonings. To get it changed is not easy. And there are many zoning attorneys throughout our state and across the country that's the only thing they do is to try to get the land rezoned. So these commercial properties that now probably will be sitting empty because if people aren't going back to work 100%, to get that changed is very complicated and very expensive. And then we get into Dee Dee's NIMBY that she said no one has mentioned, but then you have neighbors coming out and saying, I don't want this multi-housing when I when I bought it and I was next to Fiesta Mall, I didn't want housing here in my backyard. So I am against this. And a lot of times, you know, the politicians will buckle. We've seen very recently in the West Valley, there are 3 communities that are working with a developer, and the developer pulled out of one of them because it was just too much pressure, because people do not want that in their backyard. And so I think it has potential, it really does. But in order for it to be mandated, it has to go back to the legislature. But the hope is that developers will volunteer to do this and include some affordable use units in order to get maybe additional height, less parking spaces. There's all these creative things that they could actually do to include them in their projects.
All right, thank you. So Darlene's, the second part of her question was, what are the plans to finance more attainable housing for our workforce? And I think that feeds into Joanne's question from Sedona, where she says that Sedona is having a significant issue with lack of affordable housing, mostly due to short-term rentals, and the workers in Sedona can't afford to live there. They're living in their cars and in the forest. She's asking for specific advice on portable showers, but I think this is back up a little higher level around the workforce housing. And Shannon in Cottonwood also had a question about that. They have working people with 60% or above area median income in the Verde Valley who are homeless because of the lack of affordable units. So let's see, what else did Shannon have to say? They don't have, they have few resources to entice them to keep rents or sale prices affordable. And she's saying that the federal and state funds don't necessarily filter down to that rural community. Can someone comment on, I think, workforce housing and how we're financing it, or what remedies we might be looking at? And I think maybe a little description about what workforce housing is. I'm not sure which one of our panelists mentioned this, but it was that space between the 80 and 120% area median income, where folks still can't afford the rents that are, the reality of the rents in the state.
So I'm happy to start off with that. Terry, you wrapped a lot into that question. Trying to take those little, maybe piece by piece. So first, the question about what are the funding mechanisms to build in our rural areas, once again, goes back to the low-income housing tax credit. It's an incredibly important tool. There was a question in the chat box, what's the difference between 9% and 4%? 9% low-income housing tax credits are much richer. And to put it into context, every dollar of a LIHTC or low-income housing tax credit basically is resold on the market for 90 to 95 cents per dollar, right? That money is then converted into equity for a nonprofit or for-profit developer to then use to build their new affordable housing community. 9% is really for the extremely low income side that Dee Dee has talked about: permanent supportive housing, bridge, transition housing, that sort of thing, with wraparound services typically. We hope. The second low-income housing tax credit area is 4% LIHTC. 4% by federal law is first come, first serve around the country. It is not competitive. It is not competitive, it's first come, first serve. So if a developer, again, for-profit or not-for-profit, wanted to build 200 units in Sedona, they would be able to, if they were able to secure the land, big if they were able to get the zoning and building entitlements from Sedona and the city council or Kingman or Flagstaff, then they would be able to come to us if they had the requisite amount of set-asides for affordability and would be able to secure the 4% low-income housing tax credits. The 4% are not as rich as the 9%. In other words, on the open market, a 4% tax credit might be able to garner 45 to 55 cents on the dollar. That money, again, is used as the equity for the project. That is typically where we see the funding mechanism, the primary funding mechanism or financing mechanism for workforce housing. But we have a bigger issue, and that is even with all of the money available If the local city or town will not approve the zoning and building into our land entitlements, you cannot build. So Sedona, I know the comment said that the shortage of housing was primarily due to Airbnb and vacation housing. But the point remains, throughout Arizona, we have a supply and demand crisis on our hands. Our internal estimates, as you can read in the Arizona Republic article, 150,000 units and climbing that we're short in Maricopa County alone, another 100,000 units that we're short around the balance of the state, including Tucson. The only way we're going to fix this is by building more units and increasing the density, which brings us back to Dee Dee's NIMBY. The neighborhood leaders don't like density. They don't like apartments, especially workforce housing, God forbid. So these are the challenges that face every one of us as we deal with this challenge in front of us. How do we get past the neighborhood opposition for increased density and more apartments? So as much as we talk about the resources that are at hand, and we have a lot of resources right now, until we move that obstacle, we will not build more units. And it's really a challenge, especially, I'll say one last thing. So very often, especially with workforce housing, it is death by 1,000 cuts. So the developer comes in and it's delay, and 18 months later, they've lost the deal and the deal is no longer affordable because they can't control the land any longer. These are real challenges. And so maybe a bigger question is to look at what other states are doing in order to restore the leverage on the other side. So it isn't simply a dynamic of yes or no. It needs to be consensus or at least compromise. So we can continue to open that pipeline and put more apartment units all across the housing spectrum, from extremely low income to workforce to market rate. We need to be able to open that pipeline at our local level and get it all moving again.
Okay, so Cody had, oh, go ahead. Did somebody
If I
else?
could just add something, a positive spin on that. And I know that Darlene is working with Vitalist on a project to work with school districts. School districts have a lot of land that they're not utilizing right now, but there's, because it's state land and it's governed by the legislature, it's very complicated to do anything on those properties other than put a school. So, but there are ways to do it. Vitalist wrote a great paper this summer, presented it to all the superintendents across the state, and some of them are very interested in trying to get workforce housing for their employees on their property. And this isn't about the teachers, it's about the cafeteria workers, it's about the landscapers, it's about the janitors. They can't live anywhere near many schools that they work for. So that makes total sense. Another project that the Action Nexus is working on is working with the Bureau of Land Management. There's a lot of federal land in our state that doesn't have this underlying zoning where you have to do all these complicated things. Can we build on it? We'd like to find out. So we're trying to figure out some creative solutions. And this morning we had a meeting with some other federal partners to talk about possible land uses, because if they can lease that land, not only with the zoning doesn't apply, but also the expense of purchasing the land goes away. So then all you have is the construction costs, which, as Tom said, there's some issues with that. But when you take away half of the cost, there are a lot of possibilities with using some of this other land that's not zoned by the city.
Shana, Vitalist put in the chat the report about the school property. So for everyone else, Cody has a specific question about the disability community and plans to increase affordable and accessible housing for that specific community. Anybody on the panel able to answer this one?
The one thing I would add is that we know there's some been a lot of work on the national level around universal design standards. I know our housing, I have someone on that serves as a commissioner on our Housing Commission for Equitable Development. They're pushing for that. So I really think we should look at that more closely and figure out how we can incorporate that into our code. But I will say It's been difficult in working with my partners in the disability community about how to get that done. So I'm a big proponent. The question is, again, political will around that.
So Liz, you're on for the next questions. I think you have some exciting news to share with us about the city of Tucson's working plan for affordable housing. And along those lines, can you talk to us about the ADU effort in Tucson?
Yes, happy to do that. First of all, we have been given direction by mayor and council to develop a plan very similar to what City of Phoenix did, so that we have a good roadmap. We're very close. We'll be rolling that out next week to mayor and council. And hopefully finalizing that before the end of the year. But that will really, we have about 10 initiatives that will help us identify how we're going to do more affordable housing. And part of that is around zoning. Parking's a big issue around zoning when we're doing affordable housing, how to decrease cost for affordable housing. One of the things I love about Tucson when I got here is we have an impact fee waiver for developers who are doing affordable housing, nonprofit developers. I'm hoping we can expand that to for-profit developers as well. So there's a lot of good, including the ADU. We're calling it the Casita Ordinance. It passed. It allows for homeowners to add to their properties accessory dwelling units. There's some parameters around that. They're actually re-looking at the size, but the goal around that is really to add more units. Of all the public input, very clearly there was a lot of common support for people to develop, to build an ADU that would help with multi-generational needs. Also, rental options. That's why this has been a lot about affordable housing, because we know that homeowners who build an ADU and can rent it out to someone, it's going to be much less expensive than what we're seeing in the market. We're also looking at using our federal funds to do some programs around amnesty for those that are grandfathered to help bring those up to code, for those that are low-income homeowners, and hopefully in the long run, replicate some best practices in other states about financing for low-income homeowners who want to be able to build an ADU on their property. So it's passed. It was a lot of work. Again, it requires a lot of public input, but we overwhelmingly got a lot of support, a lot of concerns around whether these will be used for short-term rentals like vacation rentals, and whether investors will use that to do that. But I think in the end, it won because people know it just provides more housing options. So I'm really proud of that. We also have an approval for an overlay district to do the incentive financing if along some of our corridors. Right now it's called the Sunshine Mile, but we think it'll expand to other corridors to be able to provide a financing density, higher density, more higher height, I'm sorry to say height, for the project if they do affordable housing units. We're still working out what that looks like. Is it 15% of units at 80% AMI? That piece we're still working through. And so we've brought some consultants on to help us identify what's that right mixture, and that will be that developers would want to do. So again, I think Tucson has made some progress around those areas, but with our rolling out of our plan, we're definitely going to be proposing some other ideas.
So Liz, there was a question about the state legislature and them, I think, stifling what the municipalities can do around ADUs. Was that an issue for you?
It was not. That's one of the areas that the state legislature did not make it more difficult. You know, I saw a question around rent control. That's not anything we can do in Arizona unless that changes, along with what we were talking earlier around inclusionary zoning. So, you know, there are things that we're not able to do, but fortunately, each of the communities were all trying to find ways to, again, spur more affordable housing within the ability that we have.
Thanks, Liz. So Chella asked what type of advocacy we can do to increase voucher utilization. I think that also might be in conjunction with some of the other topics that we talked about, where we're stifled at the legislature. Does anyone want to comment on how we can bring folks in to help us advocate?
I'm going to take the first part of what you said.
All right.
So most people don't realize that Access, our Arizona healthcare cost containment system, is one of the largest apartment management entities in the state. They have hundreds and hundreds and hundreds of units under contract. And that's important to know. And that brings us back to the healthcare and housing. But the reason I mentioned it is they have recently contracted with a locally grown company called Home Inc. Home Inc. has created an initiative that is actually reaching out to new marketplace apartment communities and management companies, and basically telling them, look, could you give us 10 of your units in your not yet completed community that we will help you ramp up your leasing quicker by knowing that we will have 10 of your units under market using vouchers even before you open. So because so often apartment communities open in phases, this is actually something that is enticing to a market rate apartment management company, that to be able to get units occupied while still under construction and helping alleviate, at least to some degree, this challenge we have with a shortage of units across the state. Just one idea that is currently in play, but there will be more because so many people are talking about this, which is actually the great part of this crisis. It's brought us to the table to talk about resolution.
If I could also say, Home Inc. Has another program that kind of offers insurance to landlords. So what that does is that if they say, you know, this rider goes with this person, and if anything happens to the unit, this insurance policy will fix it. We'll also pay the last month's rent. So there's a lot of those guarantees and those little extra incentives that they don't have on other renters, I think can really help get people placed in the housing units. And I think that Home Inc.'s model, and I know the city of Tempe, they have a landlord outreach specialist, and they're hiring another one, or they just did, because they've been so successful with one, they added another one. Is that over half the units in Tempe are rental units, so why not reach out? A lot of the students didn't come back, they're virtual, so let's reach out. And they are actually placing people weeks ahead of other communities because they have these landlords kind of on speed dial that are willing to work with the city. So I think that's another model that other communities could implement, because if the city makes that connection directly with the landlords and they know kind of the city's backing this, it really puts them at ease.
Okay, any other comments around advocacy?
I was just going to say something about, I've heard Liz and Tom, Liz particularly say we can't do inclusionary zoning, we can't, have rent control, but we can. And we got 100 and some people on this call that are average voters. Tom and Liz can't. They're like, they're government officials, but we can make a difference. This is a big enough issue. Everybody's talking about it. If we can change something in our legislature around housing, now's the time. And if we really see that we want to look at some reasonable rent control, maybe not a model somewhere else, but something that works for us in Arizona, or if we want to see some type of inclusionary zoning, or might not be, again, the model that you see other places, but if enough voters and enough people with housing hitting every single family in our state, we should not take anything off the table in terms of working with our legislature and asking them what they're doing to improve this situation, along with the Department of Housing, who is asking or is leveraging their funds and utilizing the flexibility of what they have right now. So I just didn't want to go without saying that we should all be down there.
Well, and we are only one of 3 states that doesn't allow inclusionary zoning. And there's another tool called tax increment financing or TIF, and we're the only state that doesn't allow that mechanism. So yes, there's a lot. Get out and vote, just like Dee Dee said, and support candidates that support affordable housing initiatives.
So maybe another suggestion for those folks that are attending today is to follow what the Arizona Housing Coalition is doing. They're kind of our state advocacy agency. They're not kind of, they are, for affordable housing and homelessness. So, you know, get on their website, get their newsletters, sign on to things that they're doing, and help educate our legislators on this important topic. So Paul, I know he's from Yuma, but he asked about what role the USDA rural development can play. He said we have an enthusiastic new state director, Representative Charlene Fernandez, who he knows will be eager to help rural Arizona with housing problems. Is anybody familiar with the USDA rural development?
I'll just say that's a great idea, I'm so glad you mentioned Charlene, and now I'm going to reach out to her. I would love to connect with her and talk about what programs that they may have in place that we could help leverage throughout the state. That was a great idea. Thank you for that.
Okay, it looks like one of the other questions is back to the ADU. Is there anything in the regulation, or I guess in the ordinance, I'm assuming this is for Tucson, to make units stay affordable?
So there's not in the ordinance. One of the things when I was saying about developing a program to develop them, where we would put a condition if they accept our federal funds, that they would have to make that available either for Section 8 or to remain affordable. So we can do that if we provide funding for that, but just the ordinance to develop it will follow the planning guidelines.
Okay, and those are all the questions from our attendees. I think I just have one wrap-up question, and then maybe we let folks, you know, have some time to take a break today. But it's back to something that keeps popping up, and it's the $1 million question around NIMBYism. When we were having a planning call about this panel, we kind of talked about some different sectors that we believe should be involved in these conversations. And I just wanted to give everybody the opportunity to kind of weigh in on who we don't normally see at the table when we're advocating for affordable housing or when we're talking about the issues. Does anyone want to weigh in on that? No?
I'm trying to remember the conversation, Terry. I do want to just share one thing, because I saw it in the actual chat function around our industrial development authorities, the IDA. They've been have played a role, and already I've had a really great working session with them about really tying some real tangible things on how they could help in the development of affordable housing. They're a great group to always keep as good partners. But I'm still blanking out on what we were talking about, Terry, because we had some good conversations about groups. So I'll keep trying to remember.
I'll give you guys a clue. It had something to do with the business sector.
So I'll jump in.
All right.
And it goes back to our earlier conversation to me, and that is whenever a city council talks about new development, they need to incorporate the question about housing. Where are people going to live? Where are these workers going to live? Bottom line. And until we are successful in planting that seed so it becomes a part of the constant narrative, I don't think we're going to get through this. The business community should be standing up to say, we love that you're doing this. I need housing for my workers, no matter what town we're talking about, but somebody has to organize them. And I don't know what entity that would be to organize our very broad-based business community, but we need them at the table. People will listen more intently when the message is coming from somebody other than the apartment or housing development community. So hopefully we do see that moving forward.
So Tom, that's interesting that you said that. This morning I was on a GPEC call, and they were talking about their new regional strategy, and this is Maricopa County, for, you know, economic development and how they're kind of rolling it out. Every question in the Q&A asked about housing. So, you know, we're going to bring all these new jobs to the community. There's going to be this big, you know, new sector. It was around semiconductor and, you know, kind of exploding that sector. And every question was, where are these folks going to live? Whereas they talked about workforce housing, I'm thinking that some of those salaries are probably above the 120, but still, it is on the minds of the businesses or those folks in economic development. I'm sure they hear this all the time. And I guess back to your question about who organizes that, I guess that's something we need to take back and talk about. But maybe GPL is working on that effort, according to Michael Langley in the chat. So I said that there was one last question, but Kevin brought up something I think that's really interesting. It's something that we call NOAA, naturally occurring affordable housing, and that's the role of manufactured housing as part of our affordability range. Is anybody working with manufactured housing? Tom, you got it.
Manufactured housing falls under the Arizona Department of Housing. So our agency is responsible for licensing not only the manufacturers, of which there are several in the state of Arizona, but also licensing the agents, licensing the transport, licensing and inspecting where they land. And yes, manufactured housing is a very important niche in the affordable housing continuum. And we need to ensure, going back to our local municipalities, that they don't simply say no, because that's what happens. So as we're talking about the business community and advocacy, at the end of the day, I think we also need to start looking at what's going on in other states to restore some leverage to the other side of the NIMBYism equation, so that local elected officials don't simply say, yes, oh, we're so sorry. The answer is no, no more apartments. We're sorry, because that's what's happening. We need to restore some leverage. And what they're doing in Massachusetts, and I'll just kind of leave planting this seed. In Massachusetts, they have actually created a statewide appeals board. When a city or town refuses to zone or provide the land entitlements for new apartments, that developer, for-profit or nonprofit, can file an appeal to a state appeals board, and that state appeals board can overturn the local city or town council land use decision. That is huge, that's draconian, and I think we're going to see more of that across the country, maybe even here in Arizona. But something has to give, and until we break through that logjam, I think these conversations are going to continue, which is a good thing.
If I could just add, could I just add one thing? Please, as far as local officials go? So I think that individuals also just, they need to pay attention. When what happens is when there's a zoning change or a multifamily housing going up nearby and they need some kind of council approval, everyone within a certain radius is notified, and either to come to the council meeting, to come to a hearing, to come to something. Most people just throw it in the garbage. They're like, I'm fine with it. No, you need to go and say you support it. It's very easy to even send an email. You can send an email to all the council members at the same time with one click and say, I support this. Because the people that show up are the people that have a problem with it. And those are the emails that the council members get. And when that's all they hear, they think everybody's against it and they're afraid they're not going to be reelected. And it just spirals. So you have to pay attention and you have to let them know that you support that. And I say this coming from my heart. I know Tom served on the Phoenix City Council. I was on Tempe's City Council. I was on the one side of many 6-1 votes that supported affordable housing, because I didn't take a poll and count how many people emailed me about the issue. I really looked into the issue and I talked to other people that weren't contacting me too. It's so important that you pay attention. If there's a lot in your neighborhood and you see a big zoning sign, pull over, go read it, figure out what it's about, and give input on it. Either way. But I think that people, if they're okay with something, they don't speak up, and they really need to speak up. That's the only way we're going to get this built.
All right, sounds like a homework assignment. Go find the one-click email. Go ahead, Dee.
add to that too, because people were asking about, a lot of people are talking about kind of the abandoned shopping malls and things like that. And if we could really repurpose those. And that's probably the single most biggest barrier right there, is if you have to rezone something, it triggers the public process. And so every time we're looking to develop, because we're an affordable and homeless housing developer, we're looking for the entitlements that are already there that allow us to develop by right, so that we don't have to trigger that public process. Because Shannon's exactly right. It's the 3 or 4 very, very local people that oppose it, that show up and write the letters and contact the council. So I think zoning is a bigger issue than most people realize. And when it triggers the public process, the problem that creates.
All right. I think I didn't get a chance to thank Director Simplot for joining us today. He had to jump off. These CivEx webinars are usually only an hour long, but we had so much interest in this that we bumped it up to an hour and a half. And I think we've reached the threshold of how much people can talk about a topic, at least on a webinar. So I appreciate you spending your birthday with us, Shana. And Dee Dee, of course, I always appreciate your commentary. And Liz, we miss you in Mesa. And hopefully one day we'll get down to Tucson. But thank you so much for all of your input as well. And I appreciate all the attendees that stuck with us today. And don't hesitate to get in touch with any of us. We're happy to continue these conversations one-on-one.